The following is a paid advertisement of St. Anthony Hospital Orthopedics. References to any specific product, services, or entity does not constitute an endorsement or recommendation by St. Anthony Hospital, Carroll Broadcasting, or its advertisers. The views expressed by the host or guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Welcome to the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. Dr. Godding specializes in joint preservation, reconstruction, and replacement surgery, and brings over 25 years of orthopedic excellence to St. Anthony Hospital and to the Carroll area. For more information about Dr. Godding, his practice, or St. Anthony Orthopedics, go to santanthonyhospital.org or make an appointment by calling 712-794-5536.
Good Sunday morning, Iowa. It's Dr. Rick Godding, and thank you so much for spending some time with me here again this morning, or if you're here for the first time, welcome. So it is a gorgeous fall day today as I record this. Unfortunately, we know that gorgeous fall days turn into not so gorgeous fall days and turn into winter. And winter in Iowa, boy, you know, it's one of those things. You can make the best of it. It's funny because Iowa, it's much colder. So I lived in Boulder, Colorado. My dad lived there my whole life, and I did a couple semesters up at CU Boulder. And so kind of very familiar with winter in Boulder. It's colder here in Iowa than in Boulder. Boulder actually has, I think, 300 sunny days a year. So it'll snow and that'll be nice and sunny. So what we get here is we don't get enough snow to like they do in Minnesota where snowmobile everywhere and all that. And, you know, I can deal with that. I don't know that I would necessarily want that. But then a lot of times it's just cold and there's not a lot to do. I mean, luckily we have Seven Oaks up there in Boone in this part of the state to do a little skiing. But I do love a fireplace and a Christmas tree and that whole time basically between Thanksgiving and whenever you decide to take the tree down, which is taking the tree down is always tough because you take the tree down and then you're just left with bleak winter. And so we keep our lights on our house till at least February. And we try to just keep some hope for better weather going, but it's okay. I love the fall. It's absolutely spectacular. It's been a spectacular fall so far. I love riding my bike. I like football weather. I like going to games, although I haven't been to a game. I've been doing volleyball. But had a nice drive to Cedar Rapids last weekend. For volleyball. And so, you know, it is that time of year. And one of the things that I talked a little bit about last year is sort of winter snow safety with respect to fractures. And of course, as we age, you become less stable altogether. You got to understand a fall when you're 70 or older, even really, it depends on your body. I mean, some people even in the early 60s, if you fall, there's a real decent chance you're going to break something. Typically what we see, so we have these fractures that are called fractures of osteoporosis. So they're fractures that someone who has osteoporosis will get much, much easier. Not that you can't. I mean, anybody at any age can have any fracture, except, once you're a mature adult, because children will have fractures through their growth plates. But adults don't have growth plates anymore, so adults of any age can essentially get any type of fracture. You can get a hip fracture in a 22-year-old, but it's typically high-energy trauma, meaning they're riding a bike, get hit by a car, or they're in an auto accident, motorcycle, something like that. But you falling from a standing position when you were over 60 and then increase the percentage chance that something bad would happen, whatever percent per year, and over 70, over 80. I mean, if you fall from a standing height at 80 years old, you're lucky if you don't break something. So falling becomes a very, very significant issue for people that are getting older. And so there's a lot of things that you need to think about. And I think the first thing, back when I was living in Kauai and doing a lot of surfing, the big thing in the surf community is when in doubt, don't go out. And what that means is if you're sitting there on the beach and you're looking at those waves and you're thinking, I'm not sure, I think I got this, you don't go. You got to be like, oh yeah, I'm sure. In other words, each surfer, except for the very few at the very top, has sort of an index for, well, these waves are too big for me. I can't handle that. I'm not a good enough surfer. I'm not a good enough swimmer. I'm not in good enough shape. I'm too old. Whatever it is, everybody's kind of got their threshold, and almost everybody. I mean, there's only a handful of people in the whole world that'll go as big. You know, they get towed in on jet skis and 100-foot waves and all that. Your normal surfers, I mean, the rule is when in doubt, don't go out. And I like that for elderly people in the winter. Of course, I'm talking mainly about fractures, but really, I mean, there are other dangers out there. I mean, there's also, car accident dangers and just different things. So nowadays, certainly in the cities, you can get anything delivered. If you live near Walmart, you can get anything delivered. I think it's somewhere around $100 a year, and you can have unlimited deliveries as long as you're spending $35. And I'm saying this because, my mom has recently moved here from Oklahoma, and she's moved in down by where my family lives in Des Moines, where I live when I'm not here in Carroll. So Monday through Thursday, I'm here in Carroll, and then the rest of the time I'm in Des Moines, and with my family Friday through Sunday. And so when I was young, she lived up in northern Illinois, so she remembers, but it's been a long time. She's been in Oklahoma for the last 40 years or more. 43 years. So, I have to tell her, look, here's how we're going to navigate the winter. And one of the things that's nice is if you live near enough to a Walmart, I mean, you can get your groceries. I'm not saying you need to do it all the time. And I know that getting out of the house is important because socialization is important, exercise is important. But if it's early for this warning, but I'll give it again and again. I mean, I think it's so important. If I could prevent one person from having a hip fracture, then I would feel like it was worth warning multiple times. So the fractures that we call fractures of osteoporosis are compression fractures in the spine. So when people with osteoporosis will fall down, even if they fall on their butt, sometimes they will just crush their spine, their vertebrae. And it's not actually as terrible as it sounds, because it's just the thing kind of just smashes and it looks like a wedge from the side. And most of the time, there's not a big problem. You put a little brace on and you deal with it, but they can be very, very painful. Hip fractures, of course, and wrist fractures, and also what we call a distal femur, a femoral condyle fracture. These are all fractures that are much more common in patients that are older and have osteoporosis, and ankles a little bit. So the point is, if you fall from a standing height, which means your feet are on the ground and you fall, your chance of having a fracture that could be life-altering, and in the worst-case scenario, it could be life-ending, because when you have a hip fracture, most people that are going to have a hip fracture from what we call low-energy trauma. So low-energy trauma means you're standing, you're walking in your living room, and you stumble over the dog, and you fall down, and you break your hip. That's not going to happen to a 20-year-old. I mean, if that happens to a 20-year-old, then something's wrong with that patient's bones, or maybe they have cancer in their bones. I mean, it's just not going to happen. Oftentimes I'll watch my daughters play volleyball, and every single play, someone on that court does something that I know it would take me 3 weeks to recover from, especially when they start diving onto the court. And just, wow, I remember when I could do that. I remember when I played football. Long time ago, can't do that anymore. And so the point is, if you are injured by a fall from, not from a height, now fall from a height, that can be catastrophic. You should not be getting on ladders or step stools if you are over 70. And I think that there might be some slight exceptions to that rule, but that's the rule I've come up with because I've only ever seen it turn out really bad. But falling from a standing position or a walking position, that's low energy trauma. But again, at that age group, it can be really catastrophic. And a hip fracture. Now, oftentimes people that have hip fractures, a lot of times they're not exercising a lot. Some of them aren't as healthy as you would want them to be. Let's just say that. And one of the best things you can do is walk and get your exercise and lift weights, even if they're small weights, and eat a good diet with plenty of protein. That will help you to maintain your muscle mass, which will help you to maintain your bones. Your bones respond to the forces that are set across them, and if what the forces you put on them are, I get up in the morning and I walk to the kitchen, I make breakfast, and I sit and watch TV all day, and then I get up and eat lunch, and then I sit and watch TV. If that's your routine, you're setting yourself up for failure in many ways. But the happiest, healthiest people I know in their 80s exercise, and really most of them always have, but it's never too late to start. So your bones respond to the forces put across them by creating more bone. And even if you're in that bone loss stage, which everybody goes through, nobody who's 80 has the same bone stock that they had when they were 20, just like you don't have the same color hair and you don't have, probably don't have as good a teeth, all of it. I mean, bones are not an exception to that rule. However, if you've been working out the whole time, your bone stock is likely much, much, much better than it would have been. And so, one of the things that people forget, and I think a lot of doctors forget to tell people, is to lift some weights. So you can walk, you can ride your bike, however you want to get that cardio exercise and keep those legs moving, because the legs and your butt muscles, your gluteal muscles, those are the biggest muscles you have in your body. So you want those moving and you want those to be toned up. So you can do that, but don't forget to lift some weights. I mean, if you're healthy enough to do push-ups, do push-ups. If you're not healthy enough to do push-ups, you can take as little as a 1 or 2 pound weight and do some curls, and do some other exercises to increase that muscle mass. The muscle mass itself helps you to metabolize sugar, which is poison. It's one of those things that I hate to point out, but sugar is poison. It is worse for every disease process you can imagine. The more sugar you eat, the worse your health is going to be, full stop. And it's very, very hard for me to convince my teenagers of this, but it's absolutely true. And even, I'm learning that sugar is terrible for dementia. We're dealing with dementia in my family right now. My stepdad is really starting to have some very, very serious problems with dementia. And it's tough, really tough on mom. And he just, at this point, I don't think eating sugar is going to make one bit of difference to him, but he's always had a big sweet tooth, and that's not the whole story. But I did, because of his struggles and the stress that it's putting on my mom and my wife, and I guess to some extent me, of course, I'm learning more about dementia than I typically would have, and I'm seeing lots and lots of research that points to diet being a huge factor as to whether you get dementia or not. So here's the thing that's really interesting. The way you prevent fractures is the same way you prevent dementia. You eat a healthy diet and you exercise. Now, dementia, you also want to exercise your mind. You want to not be TV watching. You want to be reading books and interacting with people. There are a multitude of ways to get to interact with people. There's lots of churches out there. Go join a church. There's always help in your community. I don't know, there's a lot of communities we're talking to right now, but there's always help in your community. And in that, if you're able enough to help other people, well, that's social. And if you're not, then maybe you could get that help. So if you exercise and eat a proper diet, and the proper diet, to me, there's a lot of different ways to do it. Of course, if you've been listening for a while, I do the carnivore diet. I'm still doing that. I'm not as strict as I used to be, but pretty strict. I don't eat pizza, I don't eat sandwiches, I don't eat bread of any kind. I mean, every once in a while I'll have a nibble, but I can't remember last time I had a whole slice of bread or a bun on anything. If we're having cheeseburgers, I have a bacon cheeseburger. Sometimes I'll have 2. Sometimes I'll even have 3, but I won't have any buns, I won't have any french fries, I won't have any, occasionally a little bit of ketchup. And everything about my body has improved. My weight is way down, my muscle mass is way up, my energy is good, all of my metabolic markers. Now, these metabolic markers, it's very interesting. So your metabolic markers of what we call insulin resistance, like triglycerides are a marker of insulin resistance, resting blood sugar, hemoglobin A1C, all of those went down dramatically for me after a year of this diet. And so when I'm not saying everybody should do the carnivore diet or the keto diet or the Mediterranean diet or something, but you should pick, to me, a diet that is, first of all, any diet who is allowing you to have sugar on a daily basis is not worth doing. But if you can get rid of the sugar and you can exercise and you can keep yourself social, you will prevent fractures and you can prevent dementia, and also heart disease. I mean, it's just these things all work together. I mean, that's the thing. People, there's in our health system, a lot of things are isolated. Well, this is good for your heart, and if it's good for your heart, it's good for your bones. I can guarantee it. And if it's good for your bones, it's probably good for your heart. So again, the main kind of conversation I started having today was, you should pay attention to, making sure that you're safe when there's winter and there's ice and snow. When in doubt, don't go out. If you're worried even a little bit, don't do it. You don't have anything to prove by shoveling your walk. You can pay somebody to do it or have somebody do it. There's just a lot of ways to get out there and get hurt. So when in doubt, don't go out, and be realistic in your self-appraisal. Also understanding that the more muscle tone you have, the stronger your bones are, and the better you'll be able to avoid a slip if you start to slip or fall. You'll be able to avoid it better and to tolerate it better if it does happen. So all of these things are kind of things that I kind of harp on a lot. I mean, I love to talk about the technical aspects of surgery, and I love all these things, but there's so much in orthopedics that is preventable. And, fractures are a tremendous amount of orthopedic surgeries. I don't know what it is, but it's a huge amount of the surgery we do is fractures. Some of them are just going to happen, but a lot of them, the elderly fractures, I'm not going to say that they're avoidable, but you can reduce the chances of having them. And that's what you want to do. You want to reduce the chances. You want to make sure, do you have a good solid bar in your shower, those kind of things. But as much as anything, you want to keep that body healthy. You want to move, and then you want to keep your mind healthy. You want to read, you want to interact and have social interaction. All of these things, I feel like in our society, it becomes difficult to do the things that are the most basic and that are going to help you live the most healthy and happy life with the least amount of problems. Is just to do those basic things: move, eat right, and socialize, and keep your mind sharp. So they all go together, and it's a perfect time right now to just be getting the last of your routine outdoor walks in. We probably have, a month or two left of that before it starts to get so cold that it becomes more difficult. And you can still get your vitamin D. You can still wear a short sleeve shirt nowadays, and do all those things that are going to make that body healthier, because we are coming into the time of year that almost by definition, people get less healthy. You're going to exercise less. You're going to eat worse, especially over the holidays. You're not going to get the sunlight you need. So, take your multivitamin, which is all you need to do. You take a multivitamin, that'll give you the vitamin D you need and most of the other stuff you need. Eat a healthy diet. Give yourself a day off for Thanksgiving and a day off for Christmas. But make sure that you're exercising. And, because I think it can be something that you kind of get overwhelmed, and it's easy to lose sight of it. Now, I've 2.5 years ago, right before I started, so 2 years ago, before I started the carnivore diet, I was bad. I was 40 pounds heavier than I am, and I was super stressed out, and just the loss of the weight and the improvement in the diet and the a little bit more regular exercise, although I was exercising pretty regularly, has really made me feel so much better and healthier, and I guarantee it's never too late to take good care of yourself. You got to exercise, but 80% of your weight loss and your health is going to be diet. But they do go together strongly. So very good with that. I'll be back next week, and you have a blessed week, Iowa.
This has been the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. For more information about Dr. Godding, his practice, or St. Anthony Hospital Orthopedics, go to www.santanthonyhospital.org or make an appointment by calling 712-794-5536.